These yo-yo temperatures we've been experiencing could actually be having an impact on our health. Faiza Amin is looking into that for us. Faiza, what are health professionals telling you?
Well, first of all, Melissa, one expert told me this is a story that more people need to talk about. Listen, I don't know if you could say that we've had a typical winter here in Toronto. We've gone from, daytime highs to snowstorms to thunderstorms, and then the temps are set to drop later today as Environment Canada has issued a special weather warning. And so all of this, as a cold front is set to come here in the GTA, can have an impact on your health. So what you are experiencing and what you are feeling isn't only in your head. What impact does the changing weather with fluctuating temperatures and conditions have on our health? Well, an emergency physician and professor at the University of Alberta says there is a direct correlation, and in some case, people presenting in the emergency department, people with chronic conditions, can also particularly be impacted here. And he says at times that's for the worse. Dr. Louis Francischetti, an emergency physician and professor at the University of Alberta, says these are things that we have to learn to cope with. Here's part of our conversation.
It's important that people realize that they're feeling various aches and pains in their body. They're real. They're not in your head. So changes in weather do actually affect our health very directly. More likely to have migraines, more likely to have sinus problems, and more likely to have headaches as well. So this is for real. These are symptoms that people will experience.
And that's a result of going from one extreme to another?
That's right. The body likes to have a stable environment where it doesn't have to try and figure out what to do next.
Okay, fluctuating temps and conditions can also have impacts on our roads. Did you know that so far this year, city crews have repaired nearly 50,000 potholes, the highest number of repairs in the last 4 years? If you compare it to last year around this time, there were fewer than 30,000 potholes filled. And you might ask yourself why that is. It's because we've had a milder winter so far, so the repairs have been made more possible, but a milder winter with more freeze-thaw cycles can also increase the number of potholes on city streets. So some positives there. So the City of Toronto, ahead of today's special weather warning, says it's opening up 4 warming centers. There are also a number of drop-in programs that are available for anyone who may need it. Melissa.
Okay, so this weather can have a variety of effects on us and where we live in the world. I want to go back to what that expert said. What really stood out was that the body likes a stable environment. So what can people do to mitigate the impacts of fluctuating temperatures on their health?
So first of all, if you don't live in a house, for example, so you have no control over your humidity, he says, get a humidifier and place that in your bedroom. That can help. Another point he makes is to speak with your healthcare provider and come up with a plan, especially if you're feeling it, and especially if you have any chronic conditions like COPD, emphysema, diabetes, conditions of that sort, and just have a plan in motion. But he really wants people to know that it's not impossible, that you can talk about these things and that you can get some help for, including people who might have some mild aches and pains. And as somebody who also works in the emergency rooms, he says another impact that this fluctuating weather and the conditions and the temps also have in the emergency room is that they're seeing an increase of people who have slips and falls. That, one day it's raining like it was yesterday, the next day might be snowing, and so people might not be wearing the right or taking the right precautions, or not wearing the right gear. So he says just ensure that you're taking precautions at all times, because this isn't only something that's happening to seniors, but people of all ages.
Yeah, sure. That might not be top of mind for a lot of people, but it certainly makes sense. Some important advice there. Thanks for that, Faiza.
Thanks.